Hello, this is Honey Ong-Licudine, joined by Aaron Menguito, Kaur, Amanda Doronio, and Julia Zhu. Today, we will be talking about coccidioidomycosis, or simply known as valley fever.
What is valley fever? Valley fever is also known as coccidioidomycosis. It is a fungal infection that affects the lungs caused by inhaling the fungus that grows in the soil in some areas in southwestern United States. In severe case, this infection can spread to other parts of the body, which is called disseminated coccidioidomycosis. Per CDC, there are more than 20,000 reported cases of valley fever in 2019. About 97% of these cases occur in Arizona and California. And according to California Department of Public Health, the cases has increased from less than 1,000 cases to more than 9,000 cases in 2019. According to CDC, valley fever live in the environment in the United States. The disease is also common in northern Mexico, including areas along the US border as well as parts of Central and South America. Coccidioides lives in Arizona, California, Nevada, New Mexico, Texas, and Utah. The fungus was also recently found in south central Washington. In southern California, particularly the southern San Joaquin Valley, and in southern Arizona, including metropolitan Phoenix and Tucson, have the highest reported rates of valley fever.
So, how people get infected? People can get valley fever by breathing in dust that contains spores of the coccidioides fungus. Like seeds from plants, a fungus grows and spreads from tiny spores that are too small to see. When soil or dirt are stirred up by strong winds or while digging, dust containing these fungal spores can get into the air. Anyone who lives, works, or visits in an area where the valley fever fungus grows can breathe in these fungal spores without knowing it and can become infected. Animals, including pets, can also become infected by breathing in these spores. Valley fever is not contagious and cannot spread from person or animal to another. So, who gets valley fever? Anyone can get valley fever, including healthy adults and children, but it's most common in people aged 60 or older. Certain groups may be at higher risk of getting valley fever, and other groups may be at higher risk of having severe or disseminated disease if they get infected. So, mostly people who are at risk of getting valley fever are immunocompromised people who have weakened immune system, pregnant women, people who have diabetes, or anyone who lives or travels to southwestern United States like Arizona, California, Nevada, New Mexico, Texas, Utah, or people who lives or travel to some parts of Mexico or South or Central America, they can get valley fever as well.
Valley fever is not contagious and is extremely rare to pass it while human to human. The primary risk is exposure for this disease is through contaminated soil or dirt. Once infected, the fungus can fill the lungs with spore and can reproduce more, will be cause pneumonia and other problems. Most people, about 6 in 10, infected with valley fever, has no symptoms at all, as their bodies will fight off the infection naturally. Those people who do get sick usually develop symptoms 1 to 3 weeks after breathing in those fungus. And valley fever usually infects the lungs, and some people can develop lung infection, pneumonia, and also people who got sick may have some the following symptoms, which including like a fever, cough, chest pain, headaches, rash on the upper body or legs, muscle or joint aches, and I explained weight loss, and also with the fatigue, which means like a tired, very tired.
Healthcare providers rely on your medical and travel history, symptoms, physical examinations, and laboratory tests to diagnose valley fever. The most common way to diagnose is by taking a blood sample and sending it to a laboratory to look for coccidioides antibodies or antigens. Healthcare providers may do imaging tests such as a chest x ray or CT scans of your lungs to look for valley fever pneumonia. They may also perform a tissue biopsy to see if coccidioides will grow from body fluids or tissues. Rest and antifungal medications are currently the only treatments. There are no over the counter medications to treat valley fever. Generally, the antifungal drugs fluconazole or itraconazole are prescribed for valley fever. More serious infection may first be treated with an intravenous antifungal medication. The treatment is usually 3 to 6 months of fluconazole or another type of antifungal medication. Currently, there is no available vaccine to prevent valley fever.
Prevention. Avoid areas where you will be exposed to dirt or dust, like construction or excavation sites. If you can't avoid this area, please wear an N95 mask. Use an air filtration measures indoor. Also, make sure to wash your hands properly and clean skin injuries well to reduce the chance of developing a skin infection. Lastly, take preventative antifungal medication if your healthcare provider says you need it. If you need additional information or services related to valley fever, please feel free to contact our nearest local agencies, the San Joaquin County Public Health Services and the San Joaquin County Human Services Agency. You can also call their numbers or visit them through their website. Remember, your health is very important. Talk to your doctor about any health concerns, take prevention, and stay safe. Thank you.